I'm Dr. Amber Gazzini. I am one of the owners here at Hillsboro Wellness, and I'm getting on camera today to talk about Providence. All insurance is getting more and more complicated. All insurance is getting more and more difficult for us as providers to be able to accept and to be able to sort of operate in. Here at Hillsboro Wellness, we're fortunate we have a really good staff. We have had to pair up our staff substantially in the last probably 8 years so that we can accommodate that. But Providence and what happened with Providence this year is unlike anything we've ever seen. So when Providence decided that they were going to be administered through third-party administrators, which they have had their credentialing application through a third-party administrator for years, but claims have not been processed through them until September of last year. And part of the issue with this is that the contract that ASH administers and the payout rate and the necessity for medical necessity letters are different from what Providence required versus what ASH is requiring now. So we're playing a lot of sort of catch up. We had some people that were out of network with ASH, but we're still in network with Providence because we were previously able to do that. And now we're trying to fix that. So ASH does a tiered system where different providers are in different tiers, and based off of which tier they're in, and that's based off of how long they've been in network, how many patients they've seen. They have different requirements for medical necessity. So we have somebody like Ellen who's a tier 4, and she has a medical necessity after 5 visits. Someone like me, there's no medical necessity letters needed because I'm in their highest tier. So depending on which provider you see, there may be a medical necessity, may not. Medical necessity is done through an online sheet that we do and we fill out. It's really labor intensive. It takes us 15 to 20 minutes per medical necessity that we do. And someone who's tier 4 often only gets maybe 1 more visit, sometimes 2 more visits out of it. It is a huge burden for patients to access care because you don't get to get care while this medical necessity is going through. So if you are told that you get 30 visits a year, maybe you do, depending on which tier your provider is. So that's ASH, and ASH's commercial Providence plans only. Separately, they have what are called preferred Providence plans. So these are self-funded plans like PEB, plans like SAFE, which is a workers' compensation plan. Those plans are now being processed through Collective Health. Collective Health is an entity that, to our knowledge, never existed before 2026. And this is not just my knowledge, this is the knowledge that I have from working so closely with the Oregon Association of Acupuncturists. So my professional association hadn't even heard about it prior to 2026. So I don't know whether it existed or not, but when they input, and this is something Collective Health told us, when they input all of our contracts in, they put us all as out-of-network providers. So that means every claim is getting processed incorrectly. That means as a provider, we are wondering why for 4 units of manual therapy, that's a 16-minute massage, sometimes we're getting $88 as a reimbursement, sometimes we're getting $106, sometimes we're getting, and none of these, and I'm not offering proprietary information because we don't have a contract with Collective Healthcare, meaning there has never been this is what you're going to get paid. So our pay rates are different. We've never seen any sort of fee schedule for it. We don't know what we're getting paid. We don't know if we're getting paid properly or not. This is different than last year when we had a standard. We knew what we were going to get paid. We knew what people's deductible was going to be if they're paying towards deductible or co-insurance. And out of these plans, we haven't had any PEB plans pay. They say that they can't even see the claims inability. We haven't had any SAFE plans pay. They can't see the claims inability. We've resubmitted these claims 4 or 5 times. Over 60 days, we have not been paid at all. We just started getting payment from Intel plans last week. So we are moving through time and trying to figure this out as we go as much as possible because we want to continue to service our Providence patients. I'm sorry that it's really confusing. It is not provider driven. Nobody's more frustrated than my staff, right? So please give us grace. Please contact your human resources officers or your benefits managers or your union reps and tell them, demand that Providence does better, because Providence has said that nothing will change for their patients and nothing will change for their providers. And that is simply not true.